From CareCredit, it's Care Experts, a podcast where we dive deep into the health and pet care industry with the professionals that make it happen. I'm Antonio Diaz, and this is Logan. We all hope for the best. That's why preparing for every situation, including the worst, is crucial, especially when it comes to our pets. And it isn't just about having supplies on hand. It's about knowing what steps to take, having important information readily accessible, and having a plan in place before you need it. Preparation can make all the difference in keeping your pet safe when every second counts. To help us understand how to best prepare for pet emergencies, we're joined today by Dr. Stevie Aitken, a traveling emergency veterinarian who works in ER clinics across the country, treating pets in some of their most critical moments. She's seen firsthand how proper preparation can save lives. Beyond the ER, she's also known for her social media presence at Dr. Stevie, where she shares practical, down-to-earth advice to help pet parents stay informed and ready for any situation. Dr. Stevie's here to help you develop an emergency action plan that could save your pet's life. Well, Dr. Stevie, it's so great to have you here.
Thank you.
I know as a traveling emergency vet, you've probably seen a lot of situations that have surprised you and maybe some that haven't. I would love to hear more about situations that are maybe uncommon, or what's your craziest emergency situation that you'd like to share?
I feel like there's something new literally every single day, something that shocks and awes me. It's amazing what kind of situations these guys can get themselves into,
Right.
and has unlocked new fears throughout my short career so far. I just realized, without like fear mongering, the danger of the world. I'm sure people with kids feel the same way.
I
Like
bet, yeah.
it's unimaginable what they can get into, or things that they'll eat or do.
Yes.
And every single day it's something new. So, dogs, I think, getting into situations that you're just like, why would you do that?
Yeah, like eating rocks.
Eating
That's a big one.
rocks.
I
Why
still
are you
don't
doing
understand
that?
why
Yes.
eat a rock.
Yes.
I had a client one time with a dog with literally they shook their belly. They had a video of it because they had already brought the dog to the vet, but literally picked the dog. It was a puppy, and then just went like that, and you can hear the rocks jingling in the dog's stomach.
My gosh.
And yeah, I mean, even from a behavioral perspective, I don't understand
No.
the reason for that.
And I think the thing that gets me is like, because sometimes I'll see they'll eat rocks because somebody dumped something off of the grill, and that makes sense.
Yes.
The tube socks, really, I will never understand. Like, you have to really choke that down.
Yes.
I can't fathom. I think they get halfway into it and they're like, this was probably a bad idea, but I'm too far gone.
Yeah, I agree.
And we're just doing it.
Yeah, it's like a string of spaghetti that you're still trying to get back.
Yes,
Yeah.
exactly.
I've heard that dogs perceive pain and just handle pain differently.
Yeah.
I would agree. I see a lot of similarities between dogs and humans, because sometimes, a dog gets like poked and they're just like, oh.
Yeah.
And then other times dogs are seriously injured,
Yeah.
and it's almost like they're not even aware of it.
Nothing. I
It's
see dogs
crazy.
come in chewed up, dog attacks all the time, and they're wagging their tail. They are not a care in the world.
Yeah.
Meanwhile, I have been bit one time, and it was my own fault. It was an accident. I put my finger where it wasn't supposed to be. And like one little bite through my nail, full vagal event. I was like pale, like, oh my God, I'm going to pass out. And meanwhile, they come in. I've seen, I saw a dog one time that had chewed open her spay incision,
Okay.
intestines on the floor,
Oh my gosh.
stepping on them, and she's wagging her tail. Had no idea. Dog did fine, by the way. She's totally fine. Went to surgery. She did great. But it's just amazing to me. They're so tough. And then, like you said, sometimes not. Like, they get one little poke and they're like, oh, the world is ending.
That's Logan.
Is it?
Yeah,
He
he's
hates it.
such, It's
Yeah.
like, come on.
Yeah.
We barely even touched you.
Literally.
He's like,
Yeah.
"Oh, oh."
Yeah. Yeah. Or the broken nail, which I know is painful, but
Yeah,
they
agreed.
come in and they're like, I can't use my foot. And I'm like, you can. You're fine.
So as far as like an emergency kit, or to best be prepared for an emergency, what would you say people would have to have, or like what mentality shift do people have to be prepared for an emergency?
Yeah. So obviously it always happens at the worst time, right? So you can never be fully prepared. But I think a couple of key things that people won't even think of is know where your emergency facility is. we typically know where our like human hospitals and things like that are, or you're calling 911, you're getting an ambulance. For your pets, like you typically are the ambulance. And
Yeah.
so even just that simple fact of like, just know where your local ER is, especially because there are a lot of towns and even some cities that don't have 24-hour care. So knowing where your after hours care is, if they're open and available, if they have doctors on site, is super important. And that can reduce a lot of stress.
Yeah.
If you know that ahead of time, then when that thing does happen, you know exactly where you're going.
Gotcha.
And that can already alleviate a level of stress that otherwise would be substantial if you're busy Googling and trying to figure out how to get there.
Okay, that makes sense. Now, what about, because you said emergency care facilities. So
Mhm.
does that imply then that let's say a standard vet wouldn't really be prepared or able to handle an emergency situation?
Yeah, that's a great question. Actually, something that I come across with clients and owners a lot is that, yes, not all like general practices, you can just walk in, your dog got hit by a car, and they're prepared or equipped to see that.
Yeah.
They pretty much any veterinarian is going to have some level of knowledge of how to deal with traumas or certain emergencies that walk in. And we're talking like big, glaring, obvious emergencies, right? Like those trauma cases, those things that something's really wrong
Yeah.
versus like, oh, my pet's off. You take them to the ER and we're like, oh, they're really sick.
Yeah.
So in those situations, sometimes you will walk in and like either they don't have availability appointments that day because they are fully booked with sick pets. So yes, we're talking like a full 24-hour emergency facility. Sometimes that is on its own or like paired with a specialty hospital where
Okay.
then you get into your boarded surgeons, your neurologists, things like that. So
Gotcha.
yeah.
What was a typical situation, like in your experience? I would say like the most typical for me. I think when I think emergency, my brain automatically, for whatever reason, goes to like a hike
Yeah.
where there's an injury
Mhm.
and someone's not prepared.
Yes.
So, in the with regard to an emergency kit,
Mhm.
what would be some basics that you think that everybody should have with them?
Yeah, absolutely. So, emergency kits, like you said, hiking, if you're out doing activities on the lake, what have you. A couple of things that are super helpful is you definitely want to keep, in my opinion, I love a muzzle because if you
Yes.
like a soft muzzle, and preparing your dog with that ahead of time so that the first time you put it on, they don't freak out
Yep.
can be super helpful. If they are hurt, scared, painful, they might react in a way that
Yes.
you're not anticipating. If they just broke their leg and your dog is the nicest, kindest, and you
Yep.
go to pick them up and they're not expecting that, they're painful, there's a very real chance that they could hurt you in the process. So I love a muzzle. The other thing that I always have on me is a pair of tweezers.
Okay.
So we do a lot of hiking, me and my dog, out in like the Vegas area,
Yeah.
and you have a lot of those like jumping cactuses and things. So being
Yeah.
able to pull that out is super helpful. And then I always keep Benadryl. So I
Okay.
know I'm not like giving people medical advice necessarily, but I keep Benadryl on me because if your dog starts to have an allergic reaction, it gets stung by something, can be super helpful to get some Benadryl into them while you're headed to an emergency vet.
Nice.
Because
I
sometimes
love
you're
that.
a little ways away.
Yeah, I love
So
the tweezer recommendation. I
mhm.
would have never thought of that, and I
Yeah.
had to pull something out of Logan.
Yeah.
And again, talking about him just being sensitive, we were on a hike one time,
Yeah.
and yeah, he had something in his paw,
Mhm.
and this was early on when I first got him, and he wasn't that comfortable with my wife,
Yeah.
and so she went to grab his paw, and he was defensive.
Yeah.
He didn't bite or anything, but
Yeah.
it was like showing of teeth, rah, 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 and she
Absolutely.
kind of jumped back. She's like, what the heck? And I
Yep.
was like, don't handle him. I said,
Yep.
I'll take care of it.
Yep.
He was more comfortable with me, but yeah, it's definitely something that a lot of people are not aware of.
Mhm.
And I deal with this a lot with clients where it's like, oh, my dog is a good, happy dog, and therefore he would never bite. And
He
it's
would
like,
never.
yeah, and
Mhm.
that's not
Yeah.
true. And not to say that they would do it out of malice, but it's
Yeah.
more about just protection. It's self-preservation.
Absolutely.
Yeah, and a lot of people aren't
Yeah.
aware of that. And I love
Yeah.
the muzzle.
Mhm.
One thing that came to mind when you said a muzzle is actually a quick muzzle. Have you ever heard of a quick muzzle?
I
Like
don't
with
think
a slip leash
so.
or a leash?
No.
So using a leash to go around. So depending on what you're using,
Yeah.
if you're using a slip leash, you would go the opposite way that the leash comes out around the front and underneath the jaw
Yes.
a few times, and
Okay.
then you can use the handle to loop around back and kind of lock in place,
Brilliant.
or even just a regular leash to briefly wrap around the dog's face just as
Absolutely.
an extra layer of protection.
Yeah.
just because, again, if you have to handle them. But again, I think it's super important for people to recognize the fact that when their dog is injured, that they might be very defensive.
Yes.
So to approach that with caution.
Fear, because I hear it all the time too in the ER, is like, oh, my dog would never bite. It would never. And I'm like, well, he's telling me he's scared.
Yeah.
And fear aggression is the most common type of aggression that we see. Like a true aggression in an animal is pretty rare. But when they're scared and they're painful, that's the time that something's going to happen. And then it can also result in then that animal-human bond being broken, because then you're not expecting it. Oh my gosh, I never thought my dog would do that. And then it results in this broken trust. And so if you can just prevent that from happening, it's super, super helpful.
I do think that a lot of people take it personally.
Yes.
Yeah.
Absolutely.
It's like, I thought, my dog loved me. And it's like, but it has nothing to do with that. It's very, and that's the thing, we're talking about dogs, animals. And so it's not personal at all. It's just very,
not at all.
It's very intrinsic and super primal, if you will. Yeah.
And they will have forgotten about it in 10 minutes. So versus you now have to harbor this, like, taking it personally and feeling some sort of way. They're like, okay, I'm good now. So recently we've seen like an influx in wildfires and floods and things like that. How much should people be prepared for something like that? Because an emergency event like that, no one's really expecting it. So how can a pet parent be most prepared for a situation like that? Yeah, it's tough, right? Like it's a situation that you hope you're never in and you can't fathom going through. But you're right. Like we've seen so many things happen even just in the last year, that having some type of go bag is super important. I have told people, obviously know where you live, right? Like if you're in Florida, maybe not dealing with a wildfire, but you're going to potentially see a hurricane at some point. And so keeping some type of go container, go bag is really important. And when I talk to people about that, I like to kind of give them an idea of what should be in there, because where do you even start, right? Yeah. And so I like to tell people to have 7 days of food if you can. Now, obviously, that's much easier for like a cat than a Great Dane.
Yes.
My guy at home goes through a bag.
You need 2 bags.
Exactly. Yeah. So it gets very heavy. So if you have an animal like that, maybe not a week, maybe 2 to 3 days when you know that your online order can ship and get to you wherever you're going. So 2 to 3 days, a week ideally if you can, some bowls for food, water, an up-to-date tag for, your information, your contact information. Obviously, we all hope that we would never be separated from our pet in an emergency, but there are times where we know that humans have to go one place, animals have to go another, or they're frightened, they run. So making sure that there's some identifiable tag on them is super helpful. Or these days, I love to tell people to put like an air tag on them so that you know exactly where they are. Yeah. And then a couple other things. If you can have your vet records, either a lot of places these days are now going to like the online apps and things, but some copy of your records so that if they do have to go to some type of facility or boarding while everything's settling down, making sure that you have all those things up to date.
Gotcha.
And then similar to the food, any medications that they're on. So make sure that you have some sort of a supply of 5, 7, 10 days, especially if it's a medication that they cannot go without. So your heart meds, your especially like insulins, if you have a diabetic or things like that, to where you know that you're going to be able to get through for the next little bit until you can get a refill, see a vet, those kinds of things.
Yeah. Do you think that most people aren't prepared, like in your experience, or they're just completely
100%. Yeah.
Like, oh my gosh,
it blows me away when people are prepared. When people even just come in, because I'm on the ER side, right? So I don't have access to anyone's records. When an owner walks in with some type of record from their vet of if it's been sick for a while and they've done workup, I'm astounded, like blown away.
Yeah,
I would
like,
say,
thank you
like
so
literally,
much.
I'm like, you're making my job so much easier. I do think there's a preconceived notion of owners come in and they think that we can find that information. I'm going to tell you right now, we can't.
That's good to know.
There's no database.
Yeah.
Yes. So it's really important that if you have, especially if we don't necessarily need your rabies vaccine certificates, those kinds of things, but if your dog is on medications, most owners don't know what the medications are. Sometimes we can like puzzle it together. They're like, it's a heart medication. It starts with Pimobendan. Like we can sometimes get there, but a lot of times they don't have that information on them. So if you have meds, records, anything that you can bring in tangibly is super, super helpful, or photos of it on your phone and show us what they've got.
As you're saying that, I feel like you're like you're attacking me.
Not at all. Not at all.
Well, I say that, jokingly, But because first of all, my wife handles any medications that the dogs have needed.
Yeah.
My wife handles all that stuff. So
Yes.
if God forbid anything happened, I'd
Yeah.
probably, she'd be my emergency contact.
Yes.
Like, babe, what do I do?
100%.
And then honestly, I would have assumed too, to be honest, that if I walked into a vet's office, I could potentially give them my dog's information and maybe they would know.
Yeah.
And I think that's more so just because of the medical industry for humans. You know, you give them your social or something like that and they'll be able to pull up your record.
Yep, exactly.
So yeah, that's definitely new information for me.
Yeah. And people too, I think you're so used to going until you're in an emergency hospital with a pet. Most people that I come across, it's their first time ever having to walk into an emergency vet. You don't know what to expect.
Yeah.
And you're used to going to, a lot of times, the same vet you've been going to for 10, 15, 20 years. You've taken all of your pets there. They know them from puppy shots to whenever you have to unfortunately lose them. And so you have that relationship and they have all of their information versus then you walk into my building and you're like, I've never done this before.
Yeah.
I'm like, I got you. Let me hold your hand while we get through this. But
speaking of that, how do you handle the panic in people? Because I know, I mean, even with my wife, sometimes I'm like, babe, the dogs are okay. Like it's okay, you know, but I'm sure people come in and they're just like, fix my dog now.
Absolutely.
You know, how do you handle that? And what would you recommend for people coming in? It's easier to tell people to be calm. Like that's like, hey, calm down. But like in your experience, how do you calm people and how would you recommend for people to be a little bit more calm and like poised in a situation like that?
You're right, because emotions are so high when you're bringing your pet in. You don't know what to expect. You've never been in this situation before.
Wrong.
So I never invalidate their feelings. Like if you are freaking out, there's good reason. And I will tell you not to freak out and say like, I've got this. We can handle this. Or I will tell you when we should be panicking.
Okay.
I will let you know when you need to panic. If I'm panicked, you should be panicked. But that's pretty uncommon. So usually when people come in, I just like to validate their experience, right? Like it's like anything. When they walk in the door and they're freaking out, that's their child. That's a part of their family. And so reassuring them that like, I get it. This is one of the scariest things you've ever experienced with your pet. I want you to know that I've got you. We're going to do everything. My job makes it a little easier because the animal hospitals that I work in are what we call open concept. Okay. And so when the owner comes in, they're with their pet 100% of the time. Gotcha. So it takes the guesswork out of like, well, now my dog's in the back and I don't know what's happening. So I'm very lucky in the fact that I get to explain exactly what's happening through every step of the situation. They're also triaged immediately when they come in. And so they're seeing those things happening. They're meeting the doctor. They're meeting the nurses. I'm explaining, hey, we're getting IV into them right now so that if we need to give any life-saving drugs or pain medications, we can do that. So I like to over-explain because I think that also reduces the stress and the questions that they have, because I think part of the scariest thing is that they just don't know what to expect and they don't know what's going on and they don't know what's happening with their pet. Now they don't know, why are you poking them? Why are you doing this? And so I over-explain. I'm constantly telling them, like, this is what we're doing. This is what they're feeling. Once we get pain medications on board, like, they're comfortable now. Like I'm so glad you brought them in when you did, but now we've got some good pain meds on board. Now we can take a breath and like make a plan. So yeah, that's kind of my like way of calming people down.
I love that. I mean, I apply the same approach when I work with clients, especially with like a reactive dog or a dog that's just, you know, freaking out or maybe not taking so well to like leash pressure. Just walking them through it. Sometimes I say almost to a fault with me, but I want to make sure that they are aware of everything that's going on and even potentially, you know, helping them predict a situation that might change.
Yeah,
you know?
Absolutely. Yeah.
Yeah, that's great.
I think for owners, to answer the second part of your question, when you're coming in, it's so hard. Everybody reacts to emergencies very differently. Like, so growing up, my parents told me, if you have an emergency, do not call your dad. It's not going to go well. Call your mom. She's going to be the level-headed one. And so everyone's very different. I think, again, sort of like we talked about earlier, knowing where your ER facility is reduces a lot of stress. Being prepared. So bringing some water, bringing some snacks, obviously not always possible, bringing a phone charger so that, you know, you've kind of got access to the world if you need it. And just knowing that, again, like I said, I will tell you when we need to panic. So come in urgently.
Yeah.
Obviously advocate for your pet, but the easiest way to advocate for your pet is being able to speak clearly to the doctor. You're going to have to answer some questions.
Yeah.
Trying not to get frustrated at the process as well. So like there's going to be paperwork you have to fill out, same as the human hospital.
Yeah.
So not getting upset by like the process of it all is easier said than done. But
I can
our
imagine.
goal is the same as your goal. And like, I want to help your pet as much as you want to help your pet. And so knowing that everybody in that room is on the same team can reduce a lot of stress as well.
Yeah. And I think too, a lot of times people, they want others to respond with the same urgency and the same frantic, right, panic
Yeah.
as they are.
Yeah.
And that means that you understand. You know what I mean?
Yes.
And if you're not
Yes.
as panicked,
Yeah.
then they don't think that you're taking it seriously. And
So
that's not,
true.
because
Yeah.
it's very, and I've experienced that myself with just being so like level headed when I work with like aggressive dogs, and
Yeah.
people are just like, they're like, oh my God.
Yep.
And I'm like, it's fine. And they're like, is it though?
Yeah.
And I'm like, yeah, it's fine. Trust
Yes.
me, so I can imagine someone coming in with an emergency
Yeah.
and they're just like, oh my God, he's dying. And you're just like, what happened? And they're just, but they just want you to act, but you
Yeah.
need information.
Yeah,
So I can
absolutely.
see them panicking even more because
Yeah.
you're not responding in the way that they would expect you to or want you to.
Exactly. And
Yeah.
I promise you, if there's anything you don't want in an emergency doctor, it's them being flustered and panicked.
Can you imagine? Yeah.
you want them to
Yeah.
be cool, calm, and collected.
I
so
agree with you.
yeah. And that's why I say I like to validate their experience. But yes, you're so right. I'm not going to meet you up here. Like if
Yeah.
your emotions are up here, like I'm going to be even further down to bring you back to a level playing field. Like I want to make sure that everybody is thinking clearly. And it also is, though, if their pet, let's say, has been hit by a car, that's probably the first time they've ever experienced that. I see it every day.
Yeah.
And so also remembering that like you want a doctor that has seen this a
Yes.
million times, that does their process, that knows exactly what they need to do. And so the cooler, calmer, and more focused that they are, that's better. And so just remembering that, yeah, even if your emotions are through the roof, which is completely valid.
Yeah.
If it was my baby, believe me, I would be up there too.
Absolutely.
But in this situation, you want me very chill, calm. There's no running, there's no yelling. Actually, a little off topic, but in vet school, I never thought I would do emergency medicine. I just thought there was a lot of running and yelling, and that's sort of what I saw when I was in vet school. And I did a rotation, and it was the moment I fell in love with emergency medicine. Was I was with a doctor, and I said, "There's no running, there's no yelling, like you're not panicked." And he said, a couple of rules: I never run. If the animal dies in the 5 seconds it takes me to stand up and get there, I was not going to do anything to save them anyways.
They're on their way.
Exactly. And so it sort of reduced the stress of like, oh, we have to like, I mean, we move quickly, but like panic and run and yell.
Yeah.
There's no panicking. There's no running. There's no yelling, because we're going to do things calmly and efficiently and make sure that pet doesn't suffer and that we do it in an orderly fashion.
I love that. So do you feel when everything is going crazy around you, I don't know how to put it into words, because I guess I'm kind of touching on my own personal experience when I do like reactive workshops and there's craziness and people are just in a panic and I'm just like, it's all good.
Yes.
We got it. Like, we're going to fix this.
Yes.
There's a certain feeling, I don't know how to put it into words, but I know you know what I'm talking about. When everything around you is going crazy and you're just like, you're stoic, you're calm, you're focused, you're tuned in, right?
Yep.
You're in flow.
You're
you know
in the
exactly.
moment.
Yes. Yeah. And everyone's crazy and you just
Yep.
have this like clear path.
Yes.
I think that's such a great feeling.
Yeah, it really is. And that's exactly how I function on the ER floor. The crazier things get, the calmer I get, the more level-headed I get.
Yes.
And I love it. I thrive in the chaos. To me, it's just so fascinating to see how the world, as that chaos ensues, and then you kind of calm yourself down. And I think athletes would relate to that, of like, you just lock in that moment. You just sort of know exactly what you have to do and you get it done.
As we were speaking, it just random thought came into my mind and I want to bring it up. How often do you experience patients with bloat? Because that's an emergency that I feel like not a lot of people are aware of, and they need to know, because it's such a random thing and it's not Yeah. So
Yeah.
if you want, I would love for you to explain what
Yeah,
bloat
what bloat
is.
is. So,
Yeah.
bloat in the general term is any sort of dilation of the GI tract, typically. Our most common is going to be a gastric dilatation and volvulus. So, a GDV is typically what, like, layman terms, bloat means. What it means is that they have basically their stomach has flipped on itself internally, and then the air and the gas and the fluid has nowhere to go. So, that stomach has completely flipped on itself. Nothing can empty. And then it just continues filling with gas from the GI tract. And it will literally fill so much that that stomach will then potentially rupture. It's very scary because it's one of our only true emergencies. And I mean that sort of cavalierly with like, there are lots of emergencies,
I know
but
what you mean.
things that we have to get done quickly.
Yeah.
With a bloat case, when their stomach flips, we have about a 4 to 6 hour window, and that's it. Like if we don't fix it really quickly, and it comes on out of nowhere. So there are some theories and ideas of things that can predispose them, but we know the number one thing is genetics. So it's going to be our large breed, deep chested dogs. So Great Dane
Danes.
owners, something like 50% of Great Danes will experience it in their life. We see it in a lot of standard poodles, Dobermans, Rotties, so your big, deep-chested guys. The theory is that there's maybe more room for that stomach to swing around and happen.
And heavier food too.
Heavier
After a
food.
meal, playing after a meal is a common
Absolutely.
one that I'm aware of that would cause it.
Yeah, lots of activity directly after a meal. I see a lot with stressful events. So moves, like if they've been in the car for a long time, they have a lot of car anxiety, they're heavy panting, they're swallowing air is one that a lot of owners don't think about. And I've seen it more times than not where those Danes come in and they're like, yeah, we spent 12 hours in the car yesterday. We were moving or we were on a road trip. They were super stressed. And so that's one that I see a lot as well. So with those signs look like if they are trying to vomit and they cannot get anything out, they're just heaving and heaving, you've got to go to the vet. Like that is a true emergency that you need to get there ASAP so that we can try and intervene, because the only way that we're going to fix that is surgery. Like you have to go in, you have to unrotate that stomach. And then talking about like the prevention side of it is we do a procedure where we actually take the stomach and we suture it, we sew it to the body wall internally so that it can't happen again. And it's about 99% effective at preventing it. I've heard of one case in a hospital that I was at years ago that a dog reflipped in a different direction, which is super rare. But it is a procedure that they can actually have done when they're being spayed or neutered or early on in life to try and prevent it, because it is very scary. You have to get it really, really quickly.
Gotcha. So preventing it, one, you can do through surgery. And then just as a general approach for people, from what I know, don't feed them and then let them go run out and play.
Yes.
And then what I just learned is that it can happen from swallowing air.
Yes.
Would those be the two main situations, right?
Those are probably the two main situations. And the third, not to totally freak people out, is going to be there's no reason at all. That it just happens to happen. It's usually genetics. I have seen so many animals come in that the owners were aware of what bloat is, and that's why they got him in so quickly. But they were like, we do everything right. We don't elevate the bulls, or we do elevate the bulls, or we don't let them run after a meal. They have to sit for an hour. And I just have to look at them and go, this is not on you. This is luck of the draw, but it just happened, and that's it.
Damn.
Yeah.
All right, guys, it is time for our Ask Me Anything segment, and I can't wait. We're gonna shoot from the hip, Dr. Stevie. All right. So question one, if pet parents only have time to put together a bare minimum kit today, what are the top 3 to 5 things that they should prioritize? Where should they store it? And should they have one in the car and at home?
Okay, great questions. So I think bare minimum, top 3 things: food. Absolutely. You need food first. I would say any medications that they're on. So like daily meds, not talking about fleas, ticks, heartworms, those kinds of things, but things they need every single day to survive. Those would be my top 2. And then like a collar with updated tags with your contact information. You need a phone number that they can reach you at, home address, those kinds of things are going to be super important.
And then a leash and a collar will go for 4 and 5.
Yes, leash and
Yeah.
collar 4 and 5.
Yeah.
And I
Given
would
for sure, but just to make sure that people, yeah.
absolutely, yes. And
Because,
having one in your vehicle and like I'm obviously overcautious. I'm in the field, but I keep a leash and a collar everywhere. Slip
Same.
leashes so that if there's a stray on the side of the road, I can go get them. And
Yep.
yeah, over cautious with those kinds of things.
Love it. And then do you think people should have a bag ready to go in the house and the car, or just
Yeah.
one, or do what you can?
Yeah, I would say do what you can, but obviously you never know when emergency is going to happen.
Definitely.
So one in the car would be awesome, like keeping a little tub in the vehicle with a bag of food, collar, leash. Meds obviously can get tricky with expiration dates, and if you can get a surplus of the medication, so that would be a conversation with your vet,
Yeah.
and that would be something that you want to check every few months to make sure that it's not becoming expired, or if you know it's hurricane season, tornado season, what we're going through right now, is maybe just having it for that season, and then you can refresh the next year.
Yeah, it makes sense. I would also, something that came to mind was most medications say like store in a cool, dry place.
Yeah.
So like for me living in Vegas, probably not a good idea to have a bag full of dog's meds in the trunk of the car.
Exactly,
where it's
120
yeah,
degrees.
Exactly. Yeah, just baking in there for
Yes.
like months on end until
Exactly.
we need to use it.
Yeah.
Okay, so next question. What should I do if my dog gets bitten by a snake? How can I tell if the bite is venomous?
That's a great question. And unfortunately, unless you see the snake, you're not going to know.
Yeah.
Some telltale triggers might be if that area starts swelling really rapidly, it's super painful. There's a very good chance it's venomous, but that's not a guarantee, right? So my number one piece of advice is you just have to get to a vet. The trickiest thing is that you can't give Benadryl, you can't give like something over the counter until you get to the vet. So truly just getting there is going to be the most important thing.
Yeah.
And especially because most of the time those things have kind of ticking clocks on them, right? We want to intervene sooner rather than later. So really just getting to the emergency room is going to be important.
Yeah, I would agree with just getting the dogs to the emergency room. However, I will say that the difference between venomous snakes and non-venomous, so non-venomous are constrictors, their teeth are completely different than venomous snakes. Venomous snakes have fangs. So if you see 2 puncture wounds in your dog's skin, they're more than likely 100% bitten by a venomous snake. A constrictor has smaller teeth that actually do a really good job at gripping and holding on so that they can wrap themselves around.
Smart.
So you probably wouldn't see puncture wounds from a constrictor.
Yeah.
Just a little tip for you guys.
That's perfect.
Yeah. Side note, I used to own a python years ago, so I actually got bit in the forehead by him one time. It's totally off topic, but he got out of his cage and he was in my closet in between boxes, and I'll never forget. I was like looking for him, and then all of a sudden I feel bam,
boom,
and I was like, I had this little mark on my head. So
funny.
I survived. But all right. So I'm putting together an emergency kit for my cat, and I want to include her inhaler for her asthma.
Oh.
How can I make sure that I have enough medication in the kit?
It's a great question. It's a tricky question because it's going to be a conversation you'll have to have with your vet of if they're comfortable prescribing a backup inhaler. For that kind of medication, most of the time they would be just fine with it. If it's something that was controlled or they have to be really conscientious about how much they're giving out, it would be harder. But typically for an inhaler, you could ask for a refill of a second one and then just have that as your separate emergency inhaler.
Got you. Thank you. And then how do I safely transport my injured cat to the vet if I don't have a carrier?
Oh, you should get a carrier.
Yeah, I was going to say thoughts and prayers.
Thoughts and prayers.
Bite gloves?
Yes. Literally, bite gloves are amazing. Yeah. Otherwise, and this actually goes for not just a cat, but if let's say you have a dog or you see a stray dog or something that gets hit by a car, a big comforter. If you can like throw it over them and just scoop them up, something that's going to protect you from them is super helpful. For a cat, they are like a liquid in an animal body. Yeah. So they could probably even get out of a comforter. If you're asking this question now, I would say, let's get online. Let's order a pet carrier to your house right now.
Yeah. Cause even my suggestion to the bite gloves, like I could just imagine like holding this cat that's just
freaking out.
Not recommended.
Exactly. And to that side though, if you get them in the vehicle and then you get to the vet, please don't walk through the parking lot with your cat, even if it's not super injured, but you're just like walking in, please do not walk through a parking lot, a strange place with your cat just like chilling, unless, you know, it's like those cats on TikTok that go through TSA and they're like perfect. Your cat's probably not like that. So go inside and ask the vet clinic for a carrier, because we always have them, and we'll graciously give you one to go back out to your car with.
Yeah, I can totally see why that's the recommendation, because I can imagine you're carrying the cat and everything's fine, and then a noise or a car rides by and all of a sudden their claws dig into you, and what are you going to do?
Yep. Yeah.
You're going to let go.
Exactly. Yeah. They freak out. They fly off your shoulder. Yes. I have seen it happen. I've seen cats get away, and it is one of the worst feelings ever.
Yeah.
Because then they're scared. You're not going to get them.
Yeah. Yeah. All right. Can I take my exotic bird to the ER vet?
Yeah.
Can they treat him or her the same way they treat cats and dogs?
That's a great, I've said that every time. That's a great question. I would call. So if you have an exotic pet, first of all, even more important than a dog or a cat, know who your exotic vets in the area are, because not every veterinarian sees exotic pets. And we use the term exotic for anything that's really not a dog, a cat, or like a farm animal. So know who does see them in your area, because I can't guarantee that every ER does. I will say the ERs that I work at, we do. We will see anything that walks through the door. I'm terrified of birds, so much to my chagrin.
No way.
Terrified. That's some childhood trauma we don't have to get into. But
I want to talk about that later.
But I will still see them.
Okay, good for you.
So yes, I would definitely call before you go, just so you don't walk in expecting something to happen and then say, we don't have somebody here that sees them.
Okay.
So know where your ERs are that see them. Be prepared with that. Can we all treat them like dogs and cats? I will say no, not to just throw my colleagues and profession under the bus, but your level of knowledge that is given to you in vet school of dogs and cats is much greater than your exotic pets. We do all learn about them, and in theory have to study them for the boards and things like that. But no, I would say most ER doctors, especially because the majority of what we see are dogs and cats, that's what we're most comfortable with. Can I treat any animal for pain? Absolutely. Can I prescribe antibiotics or things like that for any species? Absolutely. The approach to a case for any species is the same, whether it's a human or a tortoise or a dog. You go kind of through that checklist of like, you know, are they bleeding? We stop the bleeding. Are they in pain? We get the pain under control. So we can all treat them. And this is also kind of a note to my colleagues too, of like, you can do this. It's not as scary as you think it is. Because exotics can be more frightening for a veterinarian that's not used to treating them. But for an owner, I would say have a realistic expectation that probably some of what we'll do is more limited than an exotic specialist.
Gotcha.
It's also a bit of like some of our blood machines to run a dog or a cat's blood in hospital can't run a bird or a reptile's blood. And so some of those diagnostics are a little bit trickier.
Makes sense.
So I would definitely kind of taper your expectations, but we do have the ability to see and treat anything.
Okay.
Yeah.
Thank you.
Mm-hmm.
Well, it's been so great chatting with you.
Yeah.
I can see the passion and the love in your eyes for what you do, and I can sense the calmness and the poise that you possess.
Thank you.
Yeah, no, I love that. And so I've really been enjoying the conversation, and just so grateful for you to join us.
Thank you so much for having me.
I really mean that. Thank you.
Yeah, this has been awesome. I love getting to share my knowledge with people that may never be exposed to that kind of thing. And so, anything I can do to help is great.
It's great to have you. Thank you.
Thanks for having me.
Whoa. Don't leave yet. I just want to say, if you want to hear more about health and pet care, check out these episodes of Care Experts. Also, before you go, make sure you hit that like and subscribe button. New episodes drop every Wednesday. You don't want to miss it.